Good morning. Thank you for joining us today. I am Melissa Silva, the Executive Director for the Mental Health Association for Greater Baton Rouge, the Louisiana affiliate for the Mental Health of America. MHA has served the Baton Rouge area and our state of Louisiana for over 66 years. MHA has partnered with the Louisiana Department of Health, Office of Behavioral Health, to offer behavioral health 911 events. These events offer education on topics affecting all of us in our state. As an advocate to those with behavioral health needs, today we're bringing you experts in the field speaking on topics specific and critical to your region. While we cannot be face-to-face to have these conversations, we do feel the need for them continues. There will be a time for questions and answers from our panel at the end of the conversation. Please enter your questions in the Q&A section. This is separate from the chat box. We will address as many questions as time allows. Today, we're partnering with Central Louisiana Human Services District to bring you behavioral health issues in correlation to rising rates of substance abuse and domestic violence. We would like to thank today's speakers for giving of their time and expertise. Please enjoy today's presentation.
Good morning and welcome to Behavioral Health 911. I am Cheryl DuBois with the Central Louisiana Human Services District. We have had this behavioral health event before and we welcome you to our virtual event. We hope to be able to get together in person again next year. I wanted to tell you a little bit about the services that the Human Services District provides. We provide mental health services in our Caring Choices Clinic. We provide substance use treatment, and we also connect people to services for developmental disabilities in Central Louisiana. We are also quite involved through our prevention department with community partnerships and drug, alcohol, tobacco, and gambling prevention services. You can find out more about our services online at clhsd.org, or you can call us. Our administrative office is 318-487-5191, and our Caring Choices clinics, that's where we provide the services for the mental health and substance use treatment, is 318-484-6850. And you can always email me for more information about our services, or if you'd like me to come and talk about our services anywhere in our 8 parishes that we serve. And my email is cheryl.dubois, and you can see that on your screen on my name there, at la.gov. Thank you for being here with us today, and we look forward to our Behavioral Health 911 Virtual Summit.
Hello, my name is Charlene Gradney, and I'm a program manager with the Louisiana Department of Health, Office of Behavioral Health. On behalf of the Office of Behavioral Health, I would like to thank and welcome each of you for joining us for today's event. We are excited to partner with MHA for community events like these. The Office of Behavioral Health has a long history of partnering with MHA as we share the same passion to educate individuals, families, and communities on behavioral health issues and how to access resources and programs in your local communities. The Louisiana Department of Health is committed to the advancement and promotion of positive health, to include positive behavioral health practices. LDH navigates with the purpose of assisting the citizens of Louisiana every day, and especially as we navigate this unprecedented health event. Dealing with disasters can cause stress and strong emotions, particularly during the COVID-19 pandemic. It is natural to feel anxiety, grief, and worry. Coping with these feelings and getting help when you need it will help you, your family, and your community. The Office of Behavioral Health and its partners have been very committed to the COVID-19 response efforts, as the global health impact of COVID-19 affects not only physical health, but social, emotional, and behavioral health. While the physical health impacts of COVID-19 are more widely known, the emotional and mental toll of this pandemic is also far-reaching. Mental health is as important to our overall health as physical health. If these stressors are not addressed and handled properly, the impact may lead to unhealthy choices, potentially including substance use and increases in negative coping and emotionally reactive behaviors. As the people of Louisiana, we continue to work together to live with the new reality of COVID-19. Unfortunately, we are no strangers to crises and disasters, as Louisiana now faces recovery from the devastation caused by Hurricane Laura. It is the commitment of the Office of Behavioral Health to partner with community programs such as MHA to provide support and resources, as well as hope and encouragement. While we may be practicing physical distancing at this time, we have never been more connected to the people we are called to serve. The Office of Behavioral Health thanks MHA for hosting this event and their commitment to serving the people of Louisiana. We would also like to thank the local partners for joining as presenters and co-hosting this event. We thank you for joining us today for this very important event.
Good morning. My name is Casey McDaniel, and I'm currently the Deputy Director of Behavioral Health for the Central Louisiana Human Services District. Mental health and substance use disorders have been a passion of mine for over 10 years now. We continue to see increases in alcohol and substance use disorders nationally and locally in our communities, and we really want to provide services that combat those issues in our community. Almost everyone that you come in contact with either knows someone who struggles with a substance use disorder or mental health issues, or is someone who struggles. In Region 6, through all 8 parishes, there are multiple agencies that are doing very important work and taking care of the people of our communities. But it's a difficult job at hand, and community awareness and support is what's most important. We want our community members to be able to walk into a nearby clinic and get services that they need, not only medically, but also behavioral health services, medication management, and everything that they are able to have to be able to lead productive lives that are successful to them. Right now, we're working on a crisis team through the LeSoar 2.0 grant. And through that crisis team, we will utilize therapists and peer support specialists, and we will go into emergency rooms, and we will go into jails, and we will bridge gaps in between really the community and getting people into treatment services, and have a holistic wraparound service on what is your intended need, what do you need from your community, what are your goals, and we want to be able to bridge that gap to be able to have families that are healthy, people able to walk into clinics and get the services they need, see a psychiatrist, have medication management, whether they're indigent, whether they have insurance or don't have insurance. Quality behavioral health care is important, and everyone should have access to it. So that is our goal, is to make sure that when you walk in somewhere that you can receive services. Community members need better quality and access to those evidence-based interventions where you can have a successful therapeutic session and you can go in and you can really get what you need from your sessions and from your treatment programming. In this area, there are different types of treatment. There's inpatient treatment where you can go in and receive behavioral health care, medication management in several different places, depending on your insurance, depending on your age, depending on what you need to take care of. There's also outpatient services and intensive outpatient services that not everybody's aware of. You can walk into one of our clinics and you can get group therapy, you can get individualized therapy, medication management, you can meet with a provider. We also do family therapy, and you can have a holistic view and we can take care of your family also. So I appreciate you letting me talk about some of your services today and some of the needs that are in the community. And I look forward to working with or having people call and get resources and have access to better care.
Hello, my name is Ricky Belgard. I'm the Addiction Resistance Program Director here at the Rapides Parish Sheriff's Office in Central Louisiana. And what a privilege it is to join this distinguished panel to talk about substance abuse issues, health issues that we're seeing from the law enforcement perspective. We're seeing an uptick of mental health issues coming into the jail. And when you have that along with the substance abuse issues, that seems to amplify everything. So we're, as law enforcement, we're not really trained to deal with mental health patients that are coming in now. And so this is beginning to be a real strain on the law enforcement system. But we're excited to have a program here in Rapides Parish that we instituted about 6 years ago called the Addiction Resistance Program that is actually set down. And we talked about the fact that incarceration is not enough for substance abuse users or mental health people. And so what we have is a couple of options. We have the Behavioral Mental Health Court that is run by Judge Doggett. And so that program helps us with the mental health issues. And then the substance abuse issues is run by me. And we found out that we can take through coordinated efforts of the stakeholders that are involved, and the stakeholders would necessarily be the district attorney's office, the judge's office, the criminal court system, the sheriffs, the jails. We use the health network, the mental health networks. We also use nonprofits, churches, pastors, and rehabilitation facilities to try to make a difference in people's lives. What we would like to do is have a diversion program. This is basically what it is, a diversion program that will help them to get them off of the substance abuse issues that they're dealing with and to move them into healthy, productive citizens and stop the recidivism that has continually going on. If we just put them in jail, let them stay for a while, put them back on the street, we haven't done anything to interdict the problem. And so with this particular program that we're using, I use a lot of Christian-based rehabs, because I've found that the Christian-based rehabs, my percentage there is about 62.5% of a success rate. Now, when you get 62.5% success rate, that's tremendous. That means that we're not seeing those people back in jail again. They're actually getting out. They're getting their families back. They're getting their kids back. They're getting jobs and being productive citizens, and they're feeling better about themselves. When people get caught up in that cycle of addiction, it seems to be a black hole for them that just spirals down forever and ever, and there's no way out of it. And if we just keep treating it the same way, then we're not gaining ground, and we're losing ground. So what we can do is if we can take those people and we can pull them out of that black hole and set them on good solid ground and give them good tools to be a success, we have found that they are looking for that. They don't actually want to be caught up in that substance abuse and those addictions of alcohol abuse or prescription drugs or illegal drugs or whatever it might be. Once they come into my office and I interview them and do an assessment on them, the story is always the same. They don't want to be in that position. And so when we offer them a chance to start afresh and anew, and we plug them into a rehab once we have one available. And when I say rehab, I don't mean a 28-day rehab or a 7-day rehab or a 1-week rehab. I'm talking 7 months to 18 months in an in-house rehab where they can actually get some help, learn to live on their own again, and actually start doing what they do and get the tools they need to be successful. And I think that's probably one of the greatest things and one of the greatest joys that I have is to be able to see those same people that have come in my office and look so haggard, and when they come out of the rehab facilities, a lot of times I don't even recognize them because they have changed so much, and the appreciation is just tremendous for what the opportunity we have been able to bless them with. And so I'm so thankful that Sheriff Wood has allowed us to do this and continue to do this, because the ultimate goal of our program is to get those people to a point that they get back into the general public and maintain useful, productive lifestyles and decrease the possibility of reoffending again or doing more crimes to get their habits met. And so it is an awesome deal to be able to do that. It's an awesome feeling to be able to help people to have that hope once again. Everyone is looking for hope. A lot of times it's just not out there, and a lot of times that no one has sat down and figured out exactly what can we do to help them. And so I'm so glad that we have this, and now it's going across. There are other departments that are picking up from us, and we're meeting with other people and sharing our program with them and helping them to understand how to implement something like this, that we can curb the substance abuse issues, the alcoholic issues, and along with the mental health issues that are going on. Now, families are always looking for hope. And isn't it great that you have a family member that says, you know what, I'm so glad there's something that can be done besides locking my son or my daughter or my granddaughter or whomever up or my spouse up. They're actually looking for hope. And then the other side of that is the fact that we'll sit down with the family members and we'll help to educate the family members about a pathway to recovery. Because what I find the majority of time is that families have a tendency to enable their kids, their spouses, or whomever is abused. They have a tendency to enable them. They want them to stop, but they can't stand it when they cry out for help, because they have to go immediately and go back to help them immediately. And so that's one of the things that has to stop too. We have to teach families how to have tough love and how to say no. They have to be willing to love their kids enough to let them hate them for just a moment, so they can get the help that they need, and that's important. And so we're excited. Like I said, we have the stakeholders that are involved, lots going on. So, God is blessing, and thank you so much for allowing us to be a part of this presentation, and just to share with you a brief overview of something that can help, of a way that maybe you haven't thought of yet, but God bless. Have a great day.
Okay, thank you for having me today. And I'm super excited about doing this and partnering with all of you. My name is Carly Long, and I am the Executive Director at the Family Justice Center here in Central Louisiana. A little bit of my background is I got my undergrad in Family and Child Studies at Louisiana Tech, and then I went on to get my master's in counseling from Loyola University in New Orleans, and a pastoral studies master's degree as well. So it led me to the Family Justice Center, and I started counseling here, offering counseling services to survivors of domestic violence and sexual assault. And I did that for a few years, and then I was able to have the opportunity to roll into the executive director position. So I am super excited and blessed to be here, and hopefully I can give you a little bit of insight regarding domestic violence and substance abuse and sexual assault and what services we have to offer. So that being said, let's get started with the PowerPoint. Just the basic general information. What is domestic violence? It is violent or aggressive behavior within the home. It typically involves violent abuse of a spouse or a partner. I know several of us know, or we have a friend or someone in the family that maybe has been through this, and so it hits close to home to a lot of people. Some of the statistics I wanted to start off, and I put several in this PowerPoint because I wanted us to really understand the seriousness of domestic violence and that these statistics are alarming. That on average, nearly 20 people per minute are physically abused by an intimate partner. This equates to more than 10 million women and men. 1 in 4 women and 1 in 9 men, which is very accurate, experience severe intimate partner physical violence, sexual violence. This is stalking. As we know, this all impacts the survivor, such as injury, fearfulness, post-traumatic stress disorder, which we see a lot of, and obviously it leads them to the use of victim services. A person is abused in the United States every 9 seconds, and that is so hard to wrap our brains around. On average, 3 women are killed by a current or former intimate partner each day in the U.S. 1 in 7 women and 1 in 18 have been stalked by an intimate partner during their lifetime at some point. And this was the one statistic that I just really thought people should know. And that's on a typical day, there are more than 20,000 phone calls placed to domestic violence hotlines nationwide. And I'll kind of talk a little bit more about this in a little bit. Intimate partner violence accounts for 15% of all violent crime, which is a lot. Women, this is a very important statistic. Most domestic violence that we see here in Cenla, the abuse happens between the ages of 18 and 24, which seems fairly young, but it's raging. It's crazy. 19% of domestic violence involves a weapon, and domestic victimization is correlated with a higher rate of depression and suicidal behavior. And what I didn't put in there was substance abuse, but there's a high correlation between the two, and we'll talk about that. I did want to cover this. Did the pandemic worsen domestic violence? I know maybe at some point you've asked yourself that during the pandemic, but the answer is yes. The factors I wanted to share today were time to exposure, economic stressors, mental health and substance abuse, and more stress and conflict at home. And I had made me a few little notes, but regarding the time to exposure, obviously if you're spending more hours in the day at home with an aggressive person, obviously the aggressive incidents are going to increase. And so that's had a huge factor in the worsening of domestic violence. Economic stressors, unemployment, financial strain, people weren't able to go to work, therefore their funds are cut or their income, and so it created a lot of stress on the aggressive incidents, aggressive people as well in the relationship. Mental health and substance abuse, these are factors that are already getting worse, and then you put them together, and it can really be bad. I will say that substance abuse is about, I would say 80%, there's an 80% correlation. So usually a domestic violence situation typically has substance abuse within it, and so me saying that about 80% of domestic violence incidents, there's always some type of substance abuse that's going on at the same time. People are already experiencing stress. When you look at number 4, the stress and conflict at home, people are already going through stress and conflicts, and children in and out of school, and like I said, the stress, the burden of finances, and you're already in an aggressive relationship. And then if drugs or alcohol are involved, and you're just limited and stuck at the house with this partner and you can't go anywhere, obviously domestic violence is going to increase. Moving on, after saying all of that, and let me add in one more thing about substance abuse. When you look at domestic violence and substance abuse, there are a lot of similarities, and that is obviously a loss of control, continued behavior, that it's just a never-ending cycle, it seems. And that both of those conditions, when you put those together, they can tend to worsen over time, which leads to addiction, and then you're in a whole nother set of issues and different ballgame. And so when thinking of domestic violence and when trying to help these survivors break the cycle, the Family Justice Center, that's where we step in, and that's where we want to say, okay, how can we help decrease domestic violence? How can we stop family violence? And how can we help people with substance abuse? How can we help them conquer this addiction? So the Family Justice Center, what we have to offer here in Cenla is it's a hidden gem, honestly. That the mission of our center is to stop family violence, to make victims able to provide. We are a one-stop shop, so we offer all of the services under one roof. They're provided a chance to speak with an advocate, develop a safety plan, interview with a detective from the Rapides Parish Sheriff's Office, meet with the prosecutor. We have a civil legal attorney on staff, and being that we're nonprofit, we're able to provide free legal services. We can help a client get a divorce if they're getting out of a abusive relationship or marriage. We can help with custody matters. Anything regarding that, we are able to provide in the civil legal department. We're also able to provide mental health services, which is a huge deal. We have so many good agencies in our area that provide mental health counseling, and fortunately we are one of those, and we have 2 counselors on staff who provide the mental health long-term counseling, and hopefully here in the next month we are going to have a substance abuse counselor on site who will be substance abuse certified, and we're going to offer substance abuse groups starting off just once a month And so stay tuned so that you can find out more information regarding that. But we do hope to have a substance abuse certified counselor that will be able to offer specific counseling to those who need it. The next is I just put on here partnering agencies because I know many people don't really understand what we do and who we reach out to. We work with the Faith House, who's another domestic violence center. Obviously, the Sheriff's Department. We work with the police departments. We serve in 9 different parishes. Right now, there's 3 main that we're super involved with, and that's Avoyelles and Grant, or 2 as of right now. So we are expanding and we're growing, and we're really happy about that. The DA's office is very involved as well because we work with them when it comes to the civil legal side of with prosecution and different things like that, protective orders and custody filings. So they've been really helpful in this process. The benefits of the Family Justice Center, I stated this briefly a second ago. So before there was a Family Justice Center, clients, they just had to travel all over town for multiple appointments. So if you had to go to the courthouse to file a protective order, or you had to go to the sheriff's office to file make a report, whatever it was, you had to travel to different agencies. Now with one facility, you can come in and you can get all of those services under one roof. And so it helps eliminate a lot of stress and a lot of the anxiety that the survivor is feeling, because they can just stay put in one place and all of those services be provided. The Family Justice Center is the way it's defined is, and you can read it along with me, a multi-agency, multidisciplinary service center where public and private agencies assign staff members on a full-time or part-time basis in order to provide services to victims of domestic violence, sexual assault, elder abuse, human trafficking, and obviously we want to reduce the number and reduce the number of places that these victims go. And so that's why we have a one-stop shop. The Family Justice Center model, this is just, I wanted to throw this in there just so you could see that we offer advocacy and transportation. We offer civil legal, we offer mental health counseling, safety planning. We offer children's services, which we really focus on sexual abuse and domestic violence. If this is out of our realm, we always refer out, work well with the Children's Advocacy Network. And so we are always referring to them if it's a case out of our scope. On the advocacy side, we can help provide housing, get them set up for a medical examination. We can help with jobs, obviously mentoring if they need help with food assistance or hygiene assistance, anything like that, we can definitely help and provide. So the new thing I wanted to share is one of our new services is our on-call program, and this is a crisis line after hours, and it's offered to our law enforcement only, and it's to provide secure emergency shelter for victims to have shelter. So if a line officer approaches a scene and it's a domestic, then he can decide, okay, this person needs to leave and get out of here. He now has a place, now has an agency to call, which is us, and then he has a place to offer that victim. And what we do is we work with the sheriff's office and we work with the police departments, and they can call our on-call number after hours, and we do a little assessment over the phone to make sure it qualifies for our services. And then we are able to get them into a hotel. If it's on the weekend, we can provide up to 3 nights on the weekend, and then during the week up to 1 night. And then we can get them in our center the following morning, get them, help for their substance abuse or help for the domestic violence. So this has been a great blessing to our law enforcement officers. This is just showing in our area in Cenla. In 2019, there were 300 restraining orders issued in Rapides Parish. That was over 2 quarters. So within 6 months, you have 300 restraining orders being filed. Louisiana is the second leading state in domestic violence. And you know, I've put this on here, but it's virtually impossible to know exactly how many cases are actually reported. So these are just the ones that are reported that we know of. And on average, we serve anywhere, it's usually, I put average because it's 120, average is about 125 new clients every quarter. Sometimes that can decrease to around 110, and then sometimes we have as many as 140-ish, 145. So, and both are male and female. I know last quarter we served 9 males, so it happens to both. And, you know, realizing that domestic violence, it can happen to anyone, any age, no matter your status quo, you know, it can happen to any of us. So the growing movement. So Family Justice Center model, it's been identified as one of the best practices in the field of domestic violence intervention and prevention. And so we hope that we can continue to reduce the fear and anxiety for victims and their children. And we hope that everyone will take advantage of our collaborative services that we offer. And we hope that you reach out to us. The next slide I put on here was just our contact information for everyone. And we now have a website, www.fjccenla.org. And again, I just encourage you to stay tuned, because like I said, we're going to eventually offer the substance abuse groups, and that will be once a month, you know, that will be provided by a certified substance abuse counselor. And we also just started trauma groups, you know, so if you know people or anyone that's been through a unhealthy relationship with abuse involved, please reach out to us and look on our website for more information. I appreciate you listening today and for giving me this opportunity, and I hope it was somewhat informative just for all to see that it does occur. Domestic violence is it's a massive issue, and we just want to help tackle that and break the cycle. So thank you again for your time.
Hey everyone, Melanie, can you give me a thumbs up that you can hear me okay?
Hey, you're good.
Okay, thanks. All right, hey everybody, my name is Erin York. I am a licensed addiction counselor and a licensed professional counselor in Shreveport, Louisiana. The program director for an outpatient facility called Forever Wellness and Recovery. And I'm also the program director for a new inpatient facility called the Uprising Addiction Center, also in Shreveport. So I'm going to share my screen so we can see my PowerPoint, because I am live right now. Okay, everybody can see that okay, Melanie?
Yes.
Okay, great. So one thing I do in my practice and in inpatient is we really focus on substance use disorders. And I'm a really big advocate for medication-assisted treatment, primarily for the Vivitrol injection. And some of you guys may know what this is, some may not. I felt this was a good topic because I speak with a lot of counselors and they say like, oh, this isn't my role. You know, this is a doctor because it's medicine. And actually there is a role that we play as therapists and advocates, and any type of face-to-face contact you might have with someone with a substance use disorder, primarily opiate and alcohol use disorder, because that's what Vivitrol treats. Unfortunately, it does not treat other substances like methamphetamines or marijuana use disorder, but hopefully that'll be something in the future that can be developed. So I'm just going to talk to you guys a little bit about how we can communicate better with our clients and people that come across us for services and how we can help them. So common myths about Vivitrol I continue to hear mainly from other therapists. Oh, that's like Suboxone, right? Absolutely not. When you hear medication-assisted treatment, people usually jump to methadone, Subutex, and Suboxone. Those are medicines used in treatment, but this is completely different. Suboxone, Subutex, and methadone, those are agonists, which means they have an active opiate in the medication. Vivitrol is an antagonist, which means there's no opiates, it's non-addictive, it's not controlled. Isn't that just another crutch? So a lot of times I hear this saying that people need to not use any kind of medicine, that therapy is the only way to get clean and sober. That's not always the case either. We use medicine for all other disorders in mental health. We use antidepressants, antipsychotics, anti-anxiety medications, and that is medication assisting treatment, which is counseling. So I don't like to consider it a crutch. I like to consider it a tool. Why would you swap one addiction for another? This goes back to Vivitrol is not a controlled substance, it's not a narcotic, it's not addictive, it's not even habit forming. Can you overdose on that? Absolutely not. When you read about Vivitrol, you're going to hear that overdose can happen, and I'm going to explain that later. It's really hard to do, but they have to put it in all their paperwork because it is a blocker. So it can kind of trick an addict's brain to think that they're using and they're trying to get that high, and then they can actually overdose. It's very rare, but it's possible, and I'll talk about that in a little bit. So the definition of MAT, so SAMHSA is my go-to when I'm looking up addiction information. MAT is the use of medications in combination with counseling and behavior therapies to provide the whole patient approach to the treatment of substance use disorders. Medication used in MAT are approved by the Food and Drug Administration, and MAT programs are clinically driven and tailored to meet each patient needs. So MAT is not for everyone, but it's definitely for some people who, chronically relapse or need something else. And I'm going to show how that works in the brain. Research also shows that a combination of meds and therapy can successfully treat those disorders. And for some people struggling with addiction, MAT can help sustain recovery. MAT is also used to prevent or reduce opiate overdose. With that being defined, wouldn't all antidepressants be considered medication of treatment too? I've got my little Freud guy thinking. This is just another thing to ponder about and think about. Like I said earlier, we use medicine and other treatments for other disorders. So my goals for today is to teach the education behind MAT, focusing on Vivitrol, because like I said, there's many other medications. We've heard of Antabuse, Camprol for alcohol use disorder, but today I'm focusing on Vivitrol. I'm going to show you how to teach your clients about Vivitrol, and I'm going to teach you how a rep can come to you. So this is a really good statistic. I learned this at a Vivitrol workshop. The percentage of relapse after one leaves an institution such as treatment or jail. And when I say institution, I just mean when a client goes and stays there for a period of time, whether it be rehab or if they have to go to prison or jail. The number, 93%. This statistic also says that relapse happens within the first 12 days of them coming home. Way too high. So what is Vivitrol? It's an opiate blocker, and it can help lower alcohol consumption, administered by a healthcare provider. So it's administered by an outpatient clinic, inpatient, a pharmacy, or a doctor. It's once a month. It's used with counseling. It's non-addictive, not a narcotic, and does require an opiate detox. Vivitrol is a prescription injectable medicine used to treat alcohol dependence. You should stop drinking before starting Vivitrol. Prevents relapse to opiate dependence after opiate detox. So for opiates, you have to be clean for roughly 7 to 10 days. It kind of depends on your provider. Alcohol, it's best if you're detox, but technically you can take the Vivitrol injection with alcohol in your system. It's not going to put you into withdrawals. Okay, so this was actually from the Vivitrol website, and this actually comes in a really cool book. And I've got some of my materials here I wanted to show y'all. It's a really neat book that my representative brought me. And on one side, when you're presenting it, the client can see this, but on the other side, it's for the counselor, and it's the same thing, but it tells you what to say. It's really neat, and that was free for me. My rep just brings it on all the time. So this kind of explains why medication-assisted treatment is so important. If we were to cut the brain in half, we're going to see two parts. So that teeny tiny limbic region is that blue part. That is for that impulsive pleasure, basic drive and urges. So no matter what, no matter how clean somebody is, if you put their drug of choice in front of them, that limbic is going to light up. Now, that doesn't mean they're going to relapse, but it means that it's going to light up. The white part, the bigger part, is that cortex. This is where the counseling, thinking, reasoning, decision-making, groups, AA, sponsorship, faith-based, whatever, comes into play. My favorite analogy to explain this is everybody has seen a depressed person, right? And they say, oh, just get up, go exercise, go be with friends, go outside. A real depressed person can't even get up out of the bed, right? So we do what? We usually prescribe a medicine, like an antidepressant, that gets them up to go out and do those things. So how Vivitrol kind of works is it gets the impulses and the cravings down enough to where you can go to counseling and go work on those things and learn coping skills. It's not just a cure-all. It helps quiet down the cravings and get you to really develop that cortex. You know, people say, oh, if they just had better coping skills, or if they just knew their relapse prevention skills. But some clients can't even get there because their relapses keep happening. So this is kind of cheesy looking, but this is how I explain it to clients, because clients are not, sometimes they have no idea what I'm talking about when I throw scientific words and lingo and brain out. So what I do, I get on my whiteboard board and I draw a big circle and I say, this is your brain. And I draw little buckets just like this. And I say, you have buckets in your brain, and we call them receptors. And they're mu receptors. These receptors are only for alcohol and opiates. Okay. These buckets want to be filled with alcohol or opiates. And I draw this. Then I draw more buckets. And I say, you have an addictive brain, so you have developed more buckets. That's why you crave your alcohol or your opiates. You're craving more than the non-addictive brain. So what Vivitrol does is it comes in and it puts lids on all those buckets, all those mu receptors. And that way it kind of quiets your cravings down. Your brain thinks your buckets are full, and so your cravings are turned down by over 50%, and relapses tend to not happen when we don't have cravings, right? After I draw the buckets, I then say about the lids. At this time, they say, but what about the other things I enjoy? They'll say, is that going to make me a zombie, or am I going to enjoy things? Vivitrol only acts on the mu receptors. The mu receptors are for alcohol and opiates. Everything else is not affected. Family, shopping, eating, spending time with your kids, your favorite candy bar, all those you're still going to enjoy. If the client uses alcohol or opiates, they would come in and see that they cannot get inside the buckets to work properly. Opiates are completely blocked, whereas alcohol isn't blocked, but there's no dopamine release. Therefore, a client wouldn't typically want to continue to drink and usually will not drink to excess. So basically how I explain it is alcohol and opiates is like a ball, and it wants to come in and jump into those buckets. When it's in the bucket, dopamine releases, and that's what makes us happy and continue to use. The ball can't even get in the bucket, so the release doesn't happen. I use a lot of analogies to explain with clients because it is kind of a hard concept to, understand sometimes. So the process of starting the injection, I go over the process with all my clients. Number one, you're going to first do an assessment. That assessment can be whatever you want. I use an ASAM assessment. Some people use an ASI. Some people have their own assessment. You're going to sign consents. A consent is basically they understand how Vivitrol works. I've made my own. You can find them online. Educate on the process, and you also are going to want to do a drug screen. You're going to do a drug screen to make sure they're not positive for any opiates. Even if they say, no, I've never taken an opiate. Some people, believe it or not, don't even know what all opiates are. And so it's just good to CYA and do a drug screen. You're then going to consult with your doctor on staff to ensure the client is a candidate for the injection. So give your doctor a call. Hey, this person's got this going on. I think they're a candidate. Your doctor will then call in an oral form of Vivitrol, which some of you may know is naltrexone. It's the same medicine. It's just an oral version. It's about 50 milligrams. This is to double check to make sure your client doesn't have a reaction. Because remember, the shot is once a month. The oral is once a day. So if I give one a shot of Vivitrol and they have some kind of crazy allergic reaction, they're going to have that every day for 30 days. The oral, they're only going to have the reaction for a day, and we'll say, they're not a candidate because they have some kind of funky reaction. Client will pick up the oral and they'll take it for 2 to 5 days. This may depend on your doctor's order. I've seen doctors say 1 to 2 days. I've seen a doctor say 7. Kind of just depends on how they feel about the medicine. The cool thing about having the oral on hand is after they take it for 2 to 3 days, they've got, 20 something pills left. So at the end of the month, if they feel, that their shot might be wearing off, or they might feel extra craving, they can take an oral naltrexone before their next injection and it won't hurt them. Once the client confirms no negative side effects, you'll complete the form. I use Fast Pharmacy to order my Vivitrol. It's one form. It's basically a demographic form: name, date of birth, insurance information. Fax it in. Shot will arrive in about 3 or 4 days. When the shot comes in, I always do one more drug screen, an instant cup, before I give the injection, or my nurse. I don't personally give it, but our nurse does, just to make sure that they don't have any opiates in their system and they're good to go. Couple more things I wanted to share before I did this last slide. I also go over, my rep has made these for me. It's basically a emergency pain management bracelet. This is so clients on Vivitrol can have this on them at all times. In the rare, instance that someone gets in a car accident, they might need pain medication. If the paramedic doesn't know that someone is on Vivitrol, they're going to stick them with probably an opiate pain relief, and it's going to be blocked. So it's always good that you educate your clients that they have got to have something like this on them if they're on the medicine. Also encourage them to share with family, doctors, put it in their phone under their medical information that they're on Vivitrol, just in case. It's rare, but it's just, a good policy to have. There's Vivitrol representatives all throughout the state of Louisiana. You can go to vivitrolhcp.com, and then you would select request a rep. I know we have one in Shreveport, and I know there is also one in New Orleans, Louisiana. I just know that because I've personally worked with them. I'm assuming there are more. But even if there's not, I know my Shreveport rep she has so many districts that she can go to and drive to. So definitely get a rep to come to you. This is how I've been educated on Vivitrol, and I didn't know how easy it was to really do it. I've got about 7 people on Vivitrol right now, and I've seen major success. Their cravings are down. They're coming to, group here with me. They're doing counseling. They're doing meetings. But I couldn't believe how easy it was to become a site. Because with Vivitrol, you have to have, a doctor, you have to do the drug screen and then offer the counseling. So it's really cool that Forever Wellness and Recovery, we do all of it under one roof. And so I know a lot of counseling agencies don't do it, but it's very, very simple. It's a lot easier than you think. And if anybody wants any help with it, I can be of help. I've been doing Vivitrol for about a year in my facility. I've had no issues. It's worked out really, really well. Success rate is super high. It's over 80% success rate when you pair Vivitrol with counseling. So again, my name is Erin York, and if you have any questions for me, I'll be happy to answer. But I'm all done. Melanie?
Hi, everyone. Thank you for attending our Behavioral Health 911 with these excellent panelists. They shared some really great information and resources with us. So now we are going to open up a few questions and answers. So Erin, I'm gonna, they have 2 questions in the chat that just came through. I'm gonna go ahead and ask you. So does Vivitrol only work on alcohol and opiates, or what about any other type of addiction, since it's, in the brain?
It only works on the mu receptors, and those receptors are responsible for alcohol and opiates. So as of right now, Vivitrol only works for those two substances. I have seen some research that naltrexone, the oral form, can also help with gambling disorder, which is not a drug at all, but it also takes down that impulsive and that craving to gamble. I personally haven't had anyone on the naltrexone for gambling disorder, but I've worked in a facility where I've seen some people on it and they swear by it, but me personally, I have not given it for that.
And does it work for depression?
I haven't seen any research on it, only because I think it goes back to that receptor. We have 1,000 receptors in our brain. They're all responsible for different things. And so I haven't heard of it helping depression.
And how long does the client have to stay on Vivitrol?
That's a magical question. My rep has a really good theory behind it, and I kind of go with her answer. The client can stay on it as little or as long. There is no withdrawal. If they say, hey, I'm just not going to get my shot next month, they just don't get it. There's no withdrawal. There's no negative side effects. They just don't get their second shot. But my rep will explain to you, she says, I love if people stay on Vivitrol for a year. And I know that sounds long, but she has a good theory. You get to go through everything once on Vivitrol. You go through Christmas, New Year's, Thanksgiving, 4th of July, anniversaries, birthdays, Mardi Gras. Mardi Gras in Louisiana is big. Memorial Day, all the holidays, you go through everything with Vivitrol being on your side, and you get to experience all those things with help with this tool. So that's a really good time frame, but it can be less or more.
All right, thank you. Mr. Bellegarde, I think this is for you. What particular services or interventions and level of care are you talking about when you say Christian-based services?
When we talk about faith-based services, these are services that do cognitive behavioral therapy. They have trained counselors on site. That's the ones that we like to use. They will also, range in time from anywhere from 7 months to 18 months of in-house rehab. So they literally get the in-house rehab. They're literally in that facility. It's like sober living, but more intense, I guess is the way to explain that.
Okay, and do you know if psychotropic drugs like SSRIs or mood stabilizers are allowed in the longer term faith-based
so what
program?
happens is, right, so what we're seeing is, and I appreciate Erin's talk and her laying that out about the Vivitrol, because one of the concerns that we have is methadone. When we put people on methadone, that's pretty well the rest of their life. You're trading one drug for another. And then they came out with the Suboxone, and Suboxone, we can actually kind of wean them off, but it's very hard. So what we're seeing is a tremendous amount of people that are hooked on the opioids, the heroin, the fentanyl, and the carfentanil that's coming in, and those that make it through that. In other words, we don't find them on the street dead. When we pick them up, we find out that they have to have medically assisted treatment, and they've got to be detoxed from that, because if you just pick those people up and put them into a rehab, you're setting them up for failure. And when we take them out of jail, we do not want to set them up for failure. We want to try to set them up for success. Now, whether they go through with that success or not is depending upon their own decisions, what they make from their own. But yes, some of the faith-based services will allow certain types of the drugs in, and if they're on some psychotropic stuff, then we have to put them into a different place. Yeah. But so each case is different. There's no cookie cutter formula that says, okay, you meet this, and this, we're going to plug you here. No, when we sit down and do the assessments on them and work with the people, we find out which place is actually going to work better. Like I said, a lot of times we'll have to put them into a long leaf or a 28-day facility. Edgefield we use a lot. that they can do some medical detox if we have not done that in the jail. Now, I will tell you that in Rat Beach Parish, I can't speak for every jail, but for Rat Beach Parish, we do have doctors and nurses that are in the jail at all time right now. And that is, so when we have people that come in and I know they've got to be detoxed and they're coming off of these drugs, then we watch them very carefully and assist with that.
Thank you. Ms. Long, do you think that alcohol and substance use affects abusers or victims at a higher rate?
So I would say typically if a victim has been involved in an abusive relationship at some point in their past, statistics show that they're more likely to abuse alcohol or, have substance abuse issues. It's kind of equal as to what we see on an everyday basis. Say the victims are just as much involved in substance abuse as the aggressor. And typically if substance abuse is involved, they are not able to make decisions. They can't think correctly. They don't understand that the abuse is even as bad as it is. They just cannot see it. And so I would say it's pretty equivalent, but definitely victims have a higher chance of using if they've been, involved in an abusive relationship.
And can I get more information on the mental health services that you also offer?
Yes. So we have 2 social workers on site. One is finishing her master's right now, so she'll be registered social worker or licensed social worker, I should say. So we have 2 social workers on site provide the mental health counseling, and basically it's majority is trauma focused. We do a lot of CBT therapy, and they stay busy. They serve Avoyelles Parish and our parish. So they have full clienteles. Right now there's a waiting list, but it moves pretty quickly. And hopefully, like I said, once we get that substance abuse counselor, even though it'll just be, once a month that we'll be able to have him or her, I think that's going to help out tremendously too, because there is so much substance abuse involved in domestics.
Okay, thank you. Ms. McDonald, can you give examples of the evidence-based interventions you spoke about?
Yes, we use different methods of evidence-based treatment options. MET, which is motivational enhancement therapy. We utilize CBT, DBT skills. We, just as was said before, we take into account what exactly the client needs, and then we curtail their treatment plan to that. It depends on the trauma that they've had, or is it substance use disorders, or what type of substance use disorders. So we have a very educated and experienced staff in both mental health and substance use disorders. And so we're able to take a look, assess, and then go from using things that have been already proven successful for patients.
And what are some warning signs that a loved one might be displaying if they are having substance use issues?
Some of the warning signs, it can be difficult. There's different signs that you can look at most of the time when you know your loved one's behavior. And so when that behavior starts to deviate, it could mimic depression. It could be your loved one is missing for extended periods of time. There's money that is missing, or you can find maybe open bottles or different things around your home. So it's really looking at your specific loved one, what their behavior was before and what you're seeing now. And so it's really good to be able to open up those lines of communication and talk to whether it's your spouse or your parents, and kind of see what's going on with them in their everyday life.
All right, thank you. Ms. Long, one more question just came through for you. It says, for the wraparound services for the Family Justice Center offers, do you have the services available, or are they contracted out to other services?
So all the services are provided here at the Justice Center. They're all active as we speak. The only services that right now we're contracting out are for the substance abuse counselor and a few other programs that we're fixing to start, but those are the only ones that are contracted out. And then, like I said at the presentation, we work with our partner agencies, and if there's any case that is out of our scope, like I said, or we feel like we're not qualified to handle it to the best of our ability, we will refer out. But yes, all of the services are provided here at the Family Justice Center.
Okay, thank you. Ms. York, I have another question for you. So does insurance pay for Vivitrol, and what about Medicaid? And also will it allow for the injection?
Yes, I'm so glad someone asked this because I left it out. Medicaid covers Vivitrol at 100%. 100%. Most commercial insurance also pay for it at 100%. So I talked about that fast pharmacy form that you'll fill out when you're wanting a person to be on it. You send that in, and they'll come back to either you or the client and say, hey, you're covered, or hey, you have a $50 copay. I have one person that has a $70 copay, and he has a TRICARE federal plan. The shot self-pay is over $1,200. So I do get some people that have no insurance that want it. And I say, well, the shot's really expensive, but the oral form, the naltrexone, is only about $40. And so sometimes that's a really good option. If an opiate addict, they're spending $200-300 probably a week. And so $40 a month to keep them clean and sober is just a small dent in their pocket, and it's worth it. But Medicaid, all the Medicaid plans, all 100% cover the injection, which is amazing.
All right, great. Someone requested your contact information. So can you either type it in the chat or just say it right now?
In the chat or the Q&A?
The chat.
Okay. So I'm going to, hold on. Where is it? Okay. So I'm putting my name, and then I'm going to put where I work, my outpatient. I'm going to put Forever Wellness and Recovery, and then I'm going to put my phone number and an email address for everyone.
Okay, thank you. Mr. Bellegarde, can you talk about the steps of the diversion and what happens after the interview process?
Okay, so as far as the interview happens, we make a determine with the person that we're interviewing. Now, it really depends because we actually can take these in 3 different ways. One is a volunteer that would come in to us and just, say, I need help. The other one is parents that, and we're getting a lot of that nowadays, by the way, parents that will actually bring someone in, their children, their teenagers, or either their older kids, and they have not been arrested yet for substance abuse issues, but their parents know they're doing them, and they'll come in and we'll talk with them and make decisions with them also. But if it's someone that we have incarcerated, then we will do the interview with them. We'll look at their charges, because not everyone would qualify for our program. In other words, there's like 6 things that we look at. The offense was a direct or indirect result of substance abuse. That's number 1 to even get to my office. The offense was nonviolent. Will not do anything with violent issues. The judicial system believes that the individual would benefit from the rehab. The individual qualifies for a probationary sentence. drugs and weapons were not involved, and the individual was not a convicted felon in possession of a weapon. Once they pass those things and they get through, then we do the interview. After the interview, then we would discuss with them what do they want their future to look like, and then we will sit down with them and discuss the different types of rehabs that are available. And then once that decision is made, we will work and make sure that everything is in place to help them get to that rehab. And so there's a lot of judicial system that has to be done to be able to move them where they need to go. So, but yes, we make all that happen.
All right, great. And Ms. Long, who would someone contact if they would like to share partner agency information? We serve first-time pregnant moms throughout the Nurse Family Partnership Program. And we have referred our clients to the Family Justice Center in the past, and they would really like to collaborate and talk more.
Absolutely. Myself, you can call me, email me, and I can do what Erin did and type it in the chat if that's easiest. Or you can contact Michelle Graham. She works at the Family Justice Center, and you can ask to speak with her, and she'll make sure I get all of the calls and information. And but definitely, I would love to speak with whoever that is.
All right, great. So we don't have any more questions in the Q&A box or the chat box. So audience, please, if you have any more, feel free to send it now. But I want to thank you again for attending. My name is Melanie Henderson, and I'm the Advocacy and Education Manager with the Mental Health Association for Greater Baton Rouge. And at the end of this, my information will be on the screen. So if you have any questions, you would like to get in touch with a panelist, I absolutely can put you in touch with them. I want to thank our partners, the Central Louisiana Human Services District, and then all of our wonderful panelists. Y'all were great, and we hope you enjoyed and are really leaving here with some important information.
I had one more thing I wanted to add.
Go ahead.
So if you guys have anybody who lives in like a rural area or is wanting the shot, I have people that will drive here just for the injection, and they get their counseling at other places. So on the Vivitrol website, you can go to find a provider or find an injection site, something like that. I have some people that say, hey, I live in Ruston. I get counseling in Ruston, but I need a place to get my second injection. I have people that come here just for the injection, and then they go about their way. So you can also search to find another injection site, and you might have one closer to you than you think. Some counseling centers do it, and some pharmacies give it, but that's also on the website.
Okay, great. Well, thank you everyone again for attending. I hope you have a wonderful day. We have a few more of these Behavioral Health 911 scheduled, so please check our website and our social media to find out more.
Thank y'all.
Thank you.
Thank you.
Enjoyed
All right.
being with everyone.
All right, bye guys.
Bye-bye.